70-year-old Bob Milne possesses an extraordinary talent. For most of his life, he's been playing ragtime on the piano effortlessly, often while carrying on a conversation. He's also demonstrated he can imagine hearing several songs at the same time. He never really practiced. Does his brain work better or just differently?
I honestly am very surprised how circumscribed the brain activity is that we see with this complex task. So if he shifts from imagining one song to 4 parallel, that's a huge workload for the brain. And yet, we don't see that much brain activity, and it is so organized, so well circumscribed, and so playful in a way.
Penn State neurologist Dr. Kirsten Betterman. She found Milne could actually imagine 4 pieces of music simultaneously.
He multitasks, and he shifts to other networks to do that, I think. And it is very playful, and it is very joyful, and he likes to do it.
MRIs show when it comes to imagining music, Milne uses different brain networks than other people, and messages cross his brain much more simply than expected.
I'm learning things about myself that I didn't know. For instance, I've always listened to 2 pieces in my head, and then when she asked me if I could hear 3, I thought, what I told her is I said, I don't know because I never tried. So she says, try it. Yeah, I did. And then she asked me to listen to 4, so I did. Now, see, I would never have known that I could do that.
Well, first of all, he can do it. That in itself is exceptional. And we've proven that. And then second, I was surprised that he does not activate as many brain centers as we thought would be required to do this task successfully. And we found that he's not using these typical executive frontal lobe centers, but that he also shifts to centers that suggest he does it playfully and more automatically.
Dr. Betterman's study on brain function could eventually impact medicine.
Long term, we try to apply this to disease stage, like people with stroke or brain injury of various sides, to see, can we stimulate some brain activation with music? Can we learn something? If you are able to shift networks in the brain, can we tap into that possibility somehow?
If doctors are able to shift brain networks, they might be able to stimulate brain activity.
We use this in speech therapy already. People that had a stroke sometimes cannot speak. They are aphasic, but they can sing. They can sing what they like. So the ability to communicate by music is maintained, but they cannot in language.
Here I am, 70 years old, and so it's no surprise to me about any of this, except that she's illuminating things that I do that I always just took for granted. I've been trying to think of the word to describe how I feel. People are interested in this that I do, and to me, am I puzzled? Am I curious? I don't know what the right word is.
John Ogle, WCVE News.